Diabetes is a chronic, often debilitating, and sometimes fatal disease whereby the body doesn't make enough insulin or it doesn't use insulin properly. Insulin is a hormone that controls the amount of glucose that's in the blood. Diabetes is a disease whereby there is too much glucose in the blood, which can cause damage to blood vessels, nerves, and organs throughout the body. There are three main types of diabetes. Type 1 diabetes typically occurs in childhood and is considered to be an autoimmune condition, whereby the body mistakenly attacks the pancreas and destroys its ability to create enough insulin for the body. As a result, too much glucose gets stuck in the blood and is unable to reach the cells. About 5 to 10% of those diagnosed with diabetes have this form. Type 2 diabetes typically occurs in adulthood and is associated with a sedentary lifestyle in addition to obesity. Unlike in type 1 diabetes, where the pancreas was destroyed or damaged, in type 2 diabetes, the body loses its ability to properly use insulin. About 90% of those diagnosed with diabetes have this form. Gestational diabetes occurs during pregnancy, and although this is considered to be a temporary form of diabetes, it does increase the risk for mom and child to develop diabetes in the future. The true cause for developing type 1 diabetes is still unclear. However, researchers have found that having a family member, such as a sibling or a parent, diagnosed with type 1 diabetes can slightly increase your risk for developing this form. This is quite a different story when we're looking at type 2 diabetes. Research has shown time and time again that obesity, especially weight accumulated around the abdomen, having high cholesterol, high blood pressure, living a sedentary life, and overconsumption of sugary drinks can all drastically increase your risk of developing type 2 diabetes. People suffering with diabetes typically experience urinating often, intense hunger or thirst, weight loss or weight gain, extreme fatigue, cuts and bruises not healing as effectively as they could, numbness and tingling throughout their hands and feet, in addition to noticing blurry vision. If left untreated or poorly treated with diet, lifestyle, and medication, this disease can progress to vision problems, which can lead to blindness, cardiovascular disease, stroke, kidney disease, which can cause kidney failure, frequent yeast infections, nerve damage, which can lead to amputations, in addition to erectile dysfunction. There are 4 main treatments that exist for all forms of diabetes. Number 1 is education. I often recommend all of my patients who've been newly diagnosed with diabetes to contact the Canadian Diabetes Association. They're a fantastic resource in order to learn more information about the disease. Number 2 is physical activity. There is no way around it. Research has shown time and time again that getting 30 minutes a day of physical activity can actually improve blood glucose levels, promote weight loss, in addition to improving overall fitness. A brisk 15-minute walk after lunch and dinner can do the trick. Number 3 is nutrition. Food can be your slowest form of poison or your greatest form of cure. What and when you eat can make the difference between well-controlled blood glucose levels versus poorly controlled levels. Finally, number 4 is medication. In the case of type 1 diabetes, it is always treated with insulin. With type 2 diabetes, if a patient is not compliant with nutrition and physical activity, the addition of supplements, medication, or even insulin may be needed in order to achieve optimal blood glucose levels. To help reduce your risk for developing type 2 diabetes or to help you manage the disease, here are 2 tips that I use with my patients. Number 1, fiber is your friend. In order to lose weight and adequately control blood glucose levels, it's really important to get fiber into your diet. You need about 50 grams a day. The average North American gets a measly 15 grams daily. So it's pretty obvious to see that we need to get creative in terms of getting more fiber into our diet. Fiber can be found in vegetables, nuts, seeds, beans, legumes, and whole grains. None of that white processed crappy stuff. An easy way to get extra fiber into your diet is with chia seeds. At only 2 tablespoons, it can provide you with 11 grams of fiber, 4 grams of protein, in addition to your omega-3s and other minerals that are needed to promote optimal blood glucose management. I oftentimes get my patients to consume 2 tablespoons of chia seeds in a glass of water about 20 minutes before meals, to be done twice a day. Number 2, get up and move. Our bodies were evolutionarily designed to be active. Set an alarm on your phone so that it goes off every hour to remind you to get up, stretch, and move about. Dedicate 10 minutes after lunch to go for a walk around your workspace. Park your car at the opposite end of the plaza. Take the stairs, or schedule a walking coffee date instead of sitting down and lounging about. All of these seemingly little changes will provide positive changes down the road to help you improve blood glucose levels in addition to losing weight.